Hey guys, so today's video is going to be on chapter 7 of Judith Beck's Cognitive Behavior Therapy, and it just basically goes over what session 2 would look like with your client. So in the initial part of the session, you first want to do a mood check, and then set the agenda, and then you want to obtain an update, and then review homework, and then prioritize the agenda for the whole session. So in the middle part of the session, first you want to work on a specific problem and teach cognitive behavior therapy skills in that context. And then you want to follow up the discussion with relevant and collaboratively set homework assignments. And then you also want to work on a second problem. So at the end of the session, you want to provide or elicit a summary, and then you want to review new homework assignments for the next session, and then you also want to elicit feedback from them. So in the first part of the session, you want to reestablish rapport, elicit the names of problems the patients themselves want help in solving, and also collect data that may indicate other important problem areas to discuss. You also want to review homework and prioritize the problems on the agenda. So some questions that the patient can ask in order to establish the goals that they want to achieve in the session are included in the Preparing for Therapy worksheet, which are: what did we talk about last session that was important? What do my therapy notes say? What has my mood been like compared to other weeks? What happened, positive and negative, this week that my therapy should know? What problems do I want to help in solving? What is a short name for each of these problems? What homework did I do? If I didn't do it, what got in the way? What did I learn? So one of the things that you'd like to do in the initial part of the session is the mood and medication check. The brief mood check creates several opportunities. First of all, you demonstrate your concern for how patients have been feeling this past week. And then you and they can monitor how they have been progressing over the course of the treatment. You can also identify and then reinforce and modify their explanation for progress or lack thereof. You can also reinforce the cognitive model, namely how patients have been viewing situations and how they have been behaving, which have influenced their mood. So did you have any problems this week, such as contemplating suicide, difficulty sleeping, feeling worthless or punished, or fearing the worst will happen, or maybe increased irritability?
I don't feel the urge to commit suicide this week, but I have had a lack of sleep. I've been in and out, haven't been getting that much rest lately. And I also have a little bit of increased irritability during this week.
So it seems like you have had more difficulty sleeping and more increased irritability than you did last session.
Yeah, compared to last week, I think.
And are you sure that you're reporting how you feel this week and not just today?
Yeah, I'm pretty sure this is how I've been feeling for this past week.
Then you want to focus on setting an initial agenda. And what are the names of the problems you'd like to talk about today?
Well, the names of the problems I've been struggling the last few days was with mostly anxiety, a little depression.
And then you want to do an update of the week. How did this week go for you?
Well, this week was a little stressful. I had a few tests.
And then you should do a homework review. Can you read your assignments out loud from your homework list?
Well, on my homework list, I had to make a new friend.
And did you do that? And what did you learn from it?
Yeah, I did make a new friend, but right now we're in a little pickle.
So I don't think it's wise for you to continue this assignment since you just met this person, tried to make them your friend, and is already in an argument with them. So I don't think we'll continue that for next week.
Okay.
And the last thing you want to do in the first part of the session is prioritizing the agenda. So you say you wanted to discuss your anxiety about your tests and the depression that you experience in trying to make friends. Did you want to spend an equal amount of time on each of these items?
Yes, I think I would like to.
So the middle part of the session, you want to reinforce the cognitive model, and then you want to continue teaching the patient to identify their automatic thoughts, and as always, maintain and build rapport through accurate understanding. First, you want to address agenda item number 1. So between the anxiety and the depression, which problem would you want to work on first?
I would like to work on anxiety first.
So what did you want to work on? Did you want to solve this problem, evaluate your thoughts a little more, or try to change your behavior?
I think I would want to work on trying to solve this problem.
Have you ever considered joining a study group to help you stay more focused?
I never considered it.
Well, that's your new homework assignment. Write it on your homework list, okay? You're gonna join one study group for one of the tests that you feel anxious about.
Okay.
Then you want to address agenda item number 2. So, what did you want to work on your depression? Did you want to solve the problem, maybe evaluate your thoughts on it, or try to change your behavior on it?
I think I would want to evaluate the problem. I feel like nobody likes me, and I don't have the courage to go up to them and just say hey. So I just keep to myself.
Do you think you're just projecting that onto them? How do you know they don't like you?
Well, I just feel like they don't like me.
That should be another assignment for you next week. Write it down on your homework list. Do one nice thing for somebody else. Say something positive to someone. And the last part of the session is the final summary and feedback. So, like we always do, I'd like to focus your attention on the most important points of this session. So first of all, we compared your feelings from last week to this week, and it seems like you're feeling worse this week than you were last week. We went over your old homework assignments, and we also discussed some new ones that we'd like to accomplish for next week. And we also went over a couple of problems that you've been experiencing. First of all, your anxiety over tests, and also the feelings of depression that you've been feeling in friend making. A topic that was in this chapter that was not addressed in the video was session 3 and beyond, as well as therapy notes, which typically includes the patient's name, the date, the session number, the objective scores, the patient's agenda, the therapist's objectives, session highlights, homework, and future sessions. This chapter outlined the structure and format of a typical early therapy session and briefly described therapy across sessions. So yeah, I hope you enjoyed the video, and I will talk to you guys later. Bye!